Good afternoon, sir. How are
Good
you?
afternoon.
Okay, my name is Mario. I'm going to be taking care of you today.
Okay.
So we're going to proceed, and this is a video for abdominal assessment. Okay, so first we got to make sure the patient is in a comfortable position with the abdomen relaxed. We could put the patient has to be supine. For the purpose of this video, this is the best we could do. The patient should be supine with a pillow underneath his head, and sometimes we could, if the patient is not relaxed enough, we could bend the legs at the knee level and keep them bent so we can make sure, and the head elevated so we can make sure that the abdomen is relaxed. So the first thing, we're going to go ahead and, okay, I'm going to uncover you. We're going to see the abdomen. So we're going to see, when we see the abdomen, we're going to start by inspection. Okay, we're going to be inspecting the abdomen for the contour, if it's flat, if it's round, any signs of the skin lesions, any rashes, any pulsations. We're going to be, I'm going to, can you go down a little bit right here? We're going to inspect for an umbilicus for any hernias or any abnormalities. We can also see to the side a little bit, so we can see for any peristalsis of the stomach movement, the normal movements of the stomach. Then this is a little bit different assessment. Now we're gonna go ahead and auscultate without touching the abdomen to not have any hyperactive bowel sounds. So we're gonna be auscultating with a diaphragm or a stethoscope. We're gonna be auscultating for bowel sounds. Okay, bowel sounds should be normal. It should be between 5 and 30 bowel sounds per minute, and we're gonna start auscultating in the abdomen and divide it into four quadrants: right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. All the assessment skills that I'm gonna be performing will be in all those four quadrants. Okay, so we're gonna start auscultating. Okay, I can see bowel sounds in all four quadrants, and they're between they're active bowel sounds all throughout. Then we can also auscultate with both the bell and the diaphragm, the stethoscope, and we're gonna be auscultating the aorta. We're gonna be auscultating the renal arteries, the iliac arteries, and the femoral arteries. We're gonna be auscultating for any bruits. Okay, so starting with the aorta, it's going to be mid in the center, right above the umbilicus. We're going to be listening for any bruits in the aorta. We go down laterally below the aorta, and we're going to be listening to the renal artery. That will be still above the umbilicus. Then we're going to go down below the umbilicus laterally for the iliac. Iliac arteries, both sides. And then you shouldn't hear any bruits. Then we're going to go to the femoral. It's lower. I'm going to keep the pants on though. The femoral. You can find the pulse before you start auscultating the femoral pulse. For this video, I'm not gonna go down. And you should listen for any bruits again. So after you finish auscultating all four quadrants, there's another. You could also auscultate for any liver rub or splenic rub, and that will be in case of enlargement. It's the same thing. You can listen to the diaphragm in the right upper quadrant for any liver rub, the rubbing, if there's any enlargement of the spleen, and that will be the same thing. Then after that, we're gonna start percussion. So for percussion, we're gonna be percussing all four quadrants: right lower, right upper, left lower, left upper. We're gonna be percussing the abdomen, and this is the position that your hand should be. You can see it right there, and then your non-dominant hand should be down, not the entire hand, only the middle finger, and you're gonna be percussing with your dominant hand. I don't know if you're gonna be able to hear it. you're gonna percuss. You should hear tympany because the abdomen is filled with air, so you should be hearing tympany sounds. If you hear any dullness in any quadrants, it should be a sign for any fluid or any fecal masses, so fecal material. After we percuss all 4 quadrants and it's tympany, then we can start percussing for the liver. So the liver, we're gonna be percussing for the liver itself, and we're also gonna be percussing for the for how the liver span, how it's located in the abdomen. So we're gonna start in the right midclavicular line. You can see the clavicle, right midclavicular line at above the umbilicus or the umbilical level. You're gonna be percussing. And when the sound changes from tympany to dullness, right here, we're gonna be mark it with a pen, right there. And then that's one end, and then you're gonna be percussing. I'm gonna cover half of you. You're gonna be percussing the midclavicular line again at the nipple line. You're gonna be percussing down. And whenever you hear that dullness, you're gonna mark. So you're gonna measure the liver span when you start with the lines that you have marked, with the landmarks that you have identified. Then you're gonna get a ruler. You're gonna measure it, and the liver span should be normal. Liver span should be between 6 and 12 centimeters. That should be percussion of the liver. After you percuss the liver, you're gonna go ahead and percuss for the spleen. So you can do the splenic percussion sign, which it should be on the left upper quadrant. You're gonna percuss the left anterior chest wall, and you should percuss. For the splenic percussion sign, you're gonna percuss in the left upper quadrant where the rib cage is at, in the last intercostal space. You should percuss. Then you should tell the patient, can you please take a deep breath? Continue, take it out. You should hear tympany will be the normal finding. If you hear any dullness with the inspiration, or anytime you're percussing when the patient is taking a deep breath, you hear any dullness, then there's a sign for splenic enlargement. You could also percuss in the left anterior chest wall laterally, and you should continue to hear tympany. If you hear any dullness, then that's also a sign for splenic enlargement. Also, we're gonna be percussing the urinary bladder. So you are gonna start below the umbilicus, and you are gonna start percussing. If you're hearing tympany, and at the time the sound changes from tympany to dullness, then that's when you could identify that there's the urinary bladder, the superior border of the urinary bladder. After we finish percussing, we're gonna go ahead and start palpation. We're gonna start with light palpation of the abdomen, and we're gonna see for any rigidity of the abdomen with one hand, or you can do 2 hands right next to each other, not to miss any spots. You're gonna do just very light palpation here for any tenderness, any pain, any rigidity, guarding. So after you finish palpating, then you can do deep palpation with one hand on top of the other one, and you're just gonna palpate. Sorry if you feel uncomfortable. Any masses, you can palpate in all 4 quadrants again. Okay, you're gonna be palpating for any masses or any abnormalities in the abdomen. When you do deep palpation, you're going to go ahead and palpate for the liver first. The liver is located in the right upper quadrant underneath the rib cage. So you're going to find the rib cage. And there's 2 techniques that you could use for this, but I'm gonna explain one and demonstrate the other. So I found the rib cage is right here, and the liver is underneath it with the inferior border. When you take an inspiration, you can feel it. So you're gonna go down in the right where the inferior margin of the right rib cage is at. You're gonna go down and up a little bit, and you're gonna tell the patient to take a deep breath. Can you please take a deep breath? And you can feel the liver when the patient takes a deep breath touching the tips of your fingers. That is a normal finding. The other one is a technique called the hook technique, and you go behind the patient, you find the rib cage, you go underneath, down, and can you take a deep breath? And then you can feel the same thing. You can feel, sometimes you can feel the liver, sometimes you cannot feel the liver. Now we're gonna palpate the spleen, okay? So for the spleen, it's the same technique, but it's gonna be on the left upper quadrant. So you're gonna find the rib cage, you can go down and up underneath the rib cage. Can you please take a deep breath? And you should not be able to feel the spleen. If you feel the spleen the same way you feel the liver touching the tip of your fingers, then that is a sign for splenic enlargement. After that is it, I think I'm done with abdominal assessment. Thank you very much.